All right, now we're moving along. We have Adam Tinner and Deborah Annan. Is Deborah here? All right. Deborah's like the happy warrior sitting in the back waiting to be called. And I think if you two will sit next to each other, we can actually bring our next panel from the DC Cancer Consortium. So Dr. Lynch, if you and Ms. Butler would come forward. Just to remind panels, they are allowed 5 minutes per panel to be shared as opposed to 3 minutes per individual. Welcome, everyone. Let's see. We'll begin with you, Mr. Tenner.
Good afternoon, Council Member. My name is Adam Tenner. I'm the Executive Director of Metro Teen AIDS. Metro Teen AIDS is also a member of the DC Alliance of Youth Advocates and a member of the DC Healthy Youth Coalition. Effective HIV prevention with adolescents not only serves to reduce new HIV infections among youth in the short term, but also provides those same young people with a lifetime of information and skills. In the last 2 years, the HIV/AIDS Administration has made tremendous strides in laying the foundation for meeting the HIV prevention needs of DC youth. In 2007, HA created the Youth and HIV Prevention Plan and has been turning this plan into very effective action. Through its Youth and HIV Work Group, HA has become the convener of community and government partners and has increased opportunities for youth service providers to partner with DC government agencies. As an example, HA was instrumental in helping to forge a relationship between Metro Teen AIDS and the Department of Parks and Rec. This made it possible for very inventive and successful collaboration. Our Young Women of Color Leadership Council, for example, our peer leaders provided HIV education to all campers in last summer's DPR teen camps. DPR also welcomed MTA as a partner in their Supreme Teen Nights, in various rec centers, including an end-of-the-summer party, which attracted 1,500 young people. This year, this model is being expanded. Despite its other problems, HA was able to provide urine-based chlamydia and gonorrhea screening to more than 1,200 youth and treatment for the majority of those youth who tested at the Department of Employment Services Summer Youth Employment Orientation. Substantial progress has also been made in youth HIV testing. In FY08, the numbers of HIV tests provided for 13 to 24-year-olds exceeded the number of tests performed in FY07, an estimated increase of more than 25%. Condoms, still our most effective form of HIV prevention and STI prevention, are now more widely available for sexually active youth than before. In the past year, the Community Health Administration collaborated with community organizations and released a revised condom availability policy for DC public and charter schools. Now, DC high school students have greater access to a wider variety of barrier methods, including male and female condoms in the school nurse's office. We also hope to continue a dialogue with CHA about how to expand the condom availability program even further. Training for government employees and their subcontractors increased in the last year with HA's support. For example, working with HA and Children's National Medical Center, Metro Teen AIDS was able to provide middle and high school nurses with training on how to conduct brief risk counseling sessions with youth who come through the nursing suites. We strongly believe that it is the district's interest to continue to expand efforts targeting the health of our youth, and that funding must continue in these efforts. Based on the most current estimates, if the FY08 district-funded prevention efforts for youth averted just one new HIV infection, the entire program will have more than paid for itself. Not only is it cost-effective to provide high-quality HIV education to young people, the majority of whom can be found each day in our city schools, but bringing HIV education to scale will provide the coming generations with the information and skills they need for a lifetime free from HIV. We're very much impressed by HA, CHA, APRA, and all the other organizations in the direction of the Department of Health.
I think the work that you have done with Metro Teen AIDS in partnership with the Department with the DC Public Schools and Department of Health is really going to reap huge dividends. And I've heard great reaction from your training of the DC nurses that are our outside contractor, Children's National Medical Center, and the work you've done. But I still think we're not quite where I'd like to see us. We're still in our infancy, and we're still waiting. And part of it is coordination with DCPS, and they're trying to reform themselves, and we're a small piece of that. And candidly, I don't think we are the number one priority for DC Public Schools right now. But, in fairness to them, we do need to let them get their house in order to some extent before they can fully engage us. Otherwise, if their structures aren't working, if we just put on what might work on top of something that doesn't work, then eventually it will unravel. So we have to be patient with them. But, I would like to see, a community constructed a kind of architecture of what and how we use the resources we have. To think of it differently, we typically will have folks who will come and say, I want this or that or the other. But what we really need are all hands on deck thinking about what are our resources and what can we do more within the existing set of resources and infrastructure. And I would ask that I know you've got plenty on your own plate, but how might we get more with what we have with respect to HIV/AIDS education in our schools now? Just an off-the-cuff question.
Well, I think I'm greatly heartened by the pace at which DC Public Schools, and we've talked about this before, and I know you've been down to visit them, is moving forward with their health education. I do think that they're probably some time before they're really fully rolled out. I think the more support from the Department of Health in terms of coordination to make sure that health education is more tightly lined with school nursing, school health care, focus on medical homes, making sure that young people not only know how to take care of their health, but learn the skills to actually go
Mr.
and get medical.
Isn't there a curriculum? I mean, I've read it. It's curriculum with all the modules, all the the components of how they're going to integrate health education in all aspects of the curriculum. So you won't just have a health class, but issue of health education will cut across all the disciplines. But at the end of the day, isn't it going to rely on the DC Public Schools to make sure that the instructors are held accountable for implementing the curriculum that has just been approved?
Absolutely, and this is, I think, the next year, this year's work and probably next year's work to make sure that there's not a lot of clarity about. I think DC Public Schools has some idea about how to assess, and we're trying to support them around how to assess whether health education is working and make sure that they have the right curriculum in place. I think there are additional. That's only 75% or 70% of the. 66% of DC's youth. I think the charter schools, it's not super clear, and trying to work with OSSI to make sure that they really move into their oversight to make sure that every student gets the same equitable amount of health education.
Well, the charter schools, which I support, though, the whole foundation of charter school, which is autonomy, creates a real challenge with respect to integrating our school-based health program into the charter schools or our mental health program into the charter schools. For starters, you need a certain critical mass to be able to, rationalize the cost of a nurse. And if it is a small charter school,
right,
it does not necessarily make sense because the nurses don't exist. And when you look at that expense, to have one freestanding nurse for a classroom or two, right, that doesn't make sense. Similarly, one of the reasons, the claims to fame for charter schools is the autonomy. Well, haven't we undermined the autonomy if no sooner have we spun them off, but then we bring them under curriculum and expectations that are forged for traditional DCPS. And this is a problem, and this is something which the council identified in its retreat earlier this month that has got to be addressed about just how do we navigate that fine line between autonomy and responsibility with respect to charter schools. But I'm even, frankly, I would be pleased to venture out of DCPS once we have DCPS fine. And, we get distracted by shiny things and we never really kind of stay on mission and then complete one thing and move on sometimes. I think we have to get our health education and our health care delivery infrastructure set in schools, and there's some real promising parts already underway, and then we venture out. And in my mind, there's inertia that has two forms. One is a simple lack of the individual human capital within the school system to make it happen. The bench is weak. You understand what I mean?
Mm-hmm.
You've got a lot of people at the top who are trying to implement the reform, but there's not a lot of people down the road down the line that can actually implement it. And authority is still questioned, and and there's not enough firepower to start executing ambition, and that takes time to develop. I mean, in this department here is a perfect example. We could not be here today overnight. It has taken, and not to suggest we're done, we are far from it, but it took, the addition of many people who are in